wanted to take some time in this last session to invite a couple of panelists to join us to have a little bit more conversation about just how this event has gone for them and also a little bit about their lived experience and their story. And so I wanted to invite up to join me today Brandon Roberts and let me see here, who else is joining me? Jen Hasty and Steph Reitberger. I'd love for you guys to join me and talk a little bit about your journey and your story. It's great to see all of you today. Thank you all so much for being here with us on this discussion panel. I'm going to let each one of you introduce yourselves. Just tell us a little bit about where you're from, how you're affected by a bleeding disorder. And we'll start with Brandon because you're the immediate person to my right. Maybe not for everybody, but at least on my screen.
Right. Can you hear me good?
Can hear you good.
Okay. So I'm a 40-year-old male with type 2A, supposed to be moderate, but I believe severe. I've been on Profi for at least 2 years. It's made a huge difference in my life, but most of the issues that I'm having to deal with now is because of years of being told vWD patients don't have joint bleeds. So,
yeah, so true. Where are you from, Brandon? Not
I
everybody
am
knows
from
you as well as I do.
Ohio, but started in Tennessee, and I have a 18-year-old daughter that we still have not gotten diagnosed because she falls in that gray area where she is 1 or 2% off from being able to be diagnosed.
Oh, man. We know that struggle all too well. Next up, we've got Jen Hasty. It's great to see you today, Jen. Thanks so much. I've seen you on, I think, every session today. You were the conference warrior with all of us today. Thanks so much for being here.
Hi, Jonathan. Thanks. I'm in the Tampa area. I have 2B. I didn't get diagnosed till I was 56. Lots of problems along that way. My kids were diagnosed very early. My 5-year-old at 5. Then the youngest one came along and was diagnosed about 16 months. And they assumed with my symptoms that it came from me, but they kept saying, you look normal, you're fine. You don't have it. You can't possibly have it. So that's
just your story and you're sticking to it.
Unfortunately.
Well, I am so glad you're here, and I appreciate you being a part of this conversation. You did a great job on your Prevent podcast interview, and I was like, man, I want to hang out with Jen more often because you're a rock star. So thanks for being on the panel this afternoon. And last but certainly not least, we've got Steph Reitberger. It is great to see you again too, Steph. You're a rock star in my world, so great to see you. And tell us a little bit about where you're from and how you're affected by a bleeding disorder.
Thank you. I live in Sheboygan, Wisconsin. I'm married and have 2 kids. My oldest is 10, and we found out at birth he has severe hemophilia. And then at 3, they added on von Willebrand disease. He also tackles an inhibitor with all of that. So we kind of straddle both that hemophilia and von Willebrand world with him. And then he has some other health challenges as well on top of all of that. I got diagnosed after he was born from prolonged postpartum bleeding. But they said it doesn't look, you're a carrier for hemophilia, but your bleeding doesn't look like hemophilia. So they tested me and I came back with von Willebrand type 1. And I've gone back and forth with diagnoses, and I've had my diagnoses removed and put back in because my levels are in the 40s, which is super bizarre. I don't know how that happens, but we're in a good treatment place right now. I have access to clotting products. I get to keep them in my fridge, which is delightful to have. I self-infuse when I can. And we are going through the diagnostic process with my daughter, who is not a hemophilia carrier, but has bleeding issues. So the next logical step would be von Willebrand disease. So we're going through some diagnostic testing with her and some back and forth with doctors. So.
Wow. Well, I have to say that going through all of the challenges that all three of you have been through in your families, I really, y'all have heard me say it before this way, and I'll say it as probably until the day I die. But the best thing that comes along with being diagnosed with a bleeding disorder is the community that comes along with it. And um, I just have to say, from my perspective, it's just so humbling and really encouraging to be able to meet and get to know you guys, because there's something that comes from battle scars that you get in your heart and mind that is completely different from people that haven't had the same set of challenges. And something that I can say about all three of you for sure is that you all have a unmovable fortitude that is a strength that is just so, it just comes through in the way that you communicate and the way that you talk about it. And so I know that you've been through a lot and it's been very hard, and sometimes there's more questions than answers. But part of the reason why I wanted you all to be on this panel this afternoon is because I really wanted to talk about. I know there's a lot of losses that we could probably talk about. I say it this way, that I have gained far more from hemophilia than hemophilia has taken from me. There have been losses. I have had things that hemophilia has taken from me that I wish I could have done or wanted to do, and I haven't been able to do. But I've also gained a lot from having a bleeding disorder as well. And some of that is in character. Some of that is in just being able to push through the hard days and go through things that other people aren't as haven't had the opportunity to have to fight the same battles that we have. So I want to talk about the wins a little bit. I want to talk about, I know that there's been a lot of hardship, and we've talked about it today throughout the sessions. I've heard a lot of rough stories going on. But Brandon, when I think about you and your family, and you've had such a robust family history as well, it has been a difficult road in a lot of directions. But you've also had some wins. You've had some successes. The fact that you're on prophylaxis was kind of against the grain by itself. The
Right.
fact that you had joint bleeds when everybody kind of said you probably can't have joint bleeds. What would you say has been the thing that has sort of led to you being able to get, to these places where you have had some successes? What are the things that have led to some of those successes for you?
As you said it in the recording earlier with me and you, warrior wife, just 100% her. And then fighting for the next generation, because
Mm,
I'm officially the first 40 plus year old in my family with the blood disorder that can still walk around without a cane.
mm,
And that is due to prophy and taking better care of my joints than they did, and just making healthier choices.
mm,
But the real thing is showing my daughter that you can't let the blood disorder hold you back. You got to
mm.
live it to the fullest. You only get
That's
one
so
shot,
good.
so just do it.
That's so good, Brandon. That's so good. Jen, I'll ask you the same thing. I know that, my goodness, you have had questions and frustrations most of your life, being diagnosed so late in your journey. But what would you say has been the things that you have had some wins along the way too, and hard fought wins for sure. But what would you say has led to some of the successes? Has there been anything that you can say that really I try again? It's just your continuation. What is it that you feel like has led to some of the wins?
Well, I agree with the little engine that could, because I could and I did. Having been told by too many providers that I couldn't possibly have it until I had a genetic test, and I was like, see, my kids got it from somewhere. But also good girlfriends in the community. When
Mm,
I was at my wit's end, and of course, I want to be strong for my girls, and I want to put out be a role model for them. I wasn't going to complain to them. I was going to be like, what's going on? And my girlfriends carried me through a lot in this community. And I am so grateful for them. They are
Mm,
dear friends now. I consider them dear, dear friends. Um,
mm,
and yeah, and the fact that I just wouldn't give up and I kept researching because it made sense to me that I had all these symptoms and their answer that my levels look normal um, is doesn't mean that that's not, I don't bleed that way. I haven't
mm,
been told I'm a severe, but I do prophy twice a week. And I believe I bleed as a severe, but because I take different medicine, it complicates the whole assay thing for me. Fortunately, I did find a hematologist that would listen to me. So those are
mm.
my take homes.
The little engine that could.
Mhm.
The little engine that did. There you go. Stephanie, you have been surrounded by a lot of hardship and a lot of challenges that I know you didn't expect going into parenthood and all of your challenges. But when I think about your story, I think about the fact that you got diagnosed and questions were answered really because of this extreme situation that happened with your son. I mean, tell me a little bit about the wins for you. Like, what do you feel like has been some of the big wins for in your story?
I think for me, the win has been, like you said, a lot of community.
Mm,
We've definitely echoed that. We've gained more than we've lost with this. We've managed to meet some incredible people along the way. We've encountered a lot of challenges, but we've always been able to tackle them because I feel like I've always had people around me encouraging me. We've
mm,
always had someone that we could call or someone that would listen to us. I remember having issues with my son in the hospital. I'm still hemorrhaging. He's inpatient as an infant. Things are going wrong with surgeons, and we still had people who said, "I'm gonna make some calls for you. Hey,
mm,
we got you a second opinion over in Cleveland or Cincinnati rather. We got you a second opinion. Would you be willing to drive out there and take it to see what's going on with your child?" We got a lot of people that just have come around us and helped us. And for me, that
mm.
has just meant more to me than anything else. Like we're going through something hard, but we don't have to do it alone.
That's so good.
And it hasn't always been the same people through the whole journey too.
Hmm.
We've changed HTCs a few times for between moves, and then having some difficulties with an HTC with some doctors and not being able to get through and get the care we needed. But we've always managed to find our way and had people along the way there with us.
That's so good. I can echo that. I know for me in our journey, we've also had times where there was groups of people that surrounded us, and then other times where different group of people. It was maybe like you said, a different treatment center, what have you. But it's interesting how I can say with a lot of confidence that probably the greatest blessing for our family has been exactly that. It's actually been the people in the community that we've been connected to in the process of it all, because it really has kept us afloat. My dad used to say about community, he would always say, Jonathan, he goes, you have to understand, he said that kind of like Noah's Ark, he said, when the floods come and everything is devastating, the only thing, he said, our community is our ark. It is the boat that's going to keep us afloat in life. And I really have cherished that and held on to that, and really been blessed to be able to have moments like this and with you guys, and to be able to learn more from you in the process as well, and just practical steps, and as well as just having a shoulder to cry on sometimes when you need that. Um,
Mhm.
I want to talk a little bit about the future, because I feel like, we talked about the past some, we've talked about throughout the day, and we've talked about even what's treatments are available currently. But I want to talk a little bit about the future, because you guys have obviously lived it. And I just would like to know, Brandon, you started out with talking about the next generation, and so poignant, because it was serendipitous, I think, that my daughter, the next generation, introduced me even on this call. So here we go. Let's just keep that theme going. When you think about the next generation, Brandon, I mean, do you have hope that things are going to improve and that we're going to solve even more problems? Like, what are you thinking about when you think about the future? Is it hopeful or does it feel more dark?
It's hopeful. I mean, the next step for me is we are trying to enroll me in the Hem Libra study for vWD. Um, it's been promising with type threes with
Mm-hmm.
no um, vWD factors. So um, we're trying to get me into the brand new study that just opened up for type twos. Um, and of course, they want like 3 years worth of lead logs to prove that it's going to do anything positive. But it looks promising, and we've been watching it. And I mean, that's a huge step for our community. I mean, I've seen several people in the community with hemophilia take this drug, and it changed their lives. So,
Mm-hmm.
yeah, I mean, it's promising. And just the technology out now just helps everybody.
It's true. It's very true. Jen, when you look to the future, do you feel like that there's a positive outlook for people getting diagnosed more quickly than you were? Do you feel like that there's more? Does it look hopeful to you as well? How do you feel about the future?
Yes, I think that it seems there's a very slow uh, progression towards looking at the symptoms and the amount of bleeding as opposed to levels. I think that's a huge improvement, especially for VWD, because we are so many things can skew it so easily. And I also say that I think for the next generation, for my girls, I'm glad that they have gotten this information so much sooner than I, so they don't have the same, they're not going to have the arthritis everywhere. And they know that bleeds are real and they can get them.
Mm-hmm.
So they've they've got records, and there's no one that's going to, say, no, you don't have it um,
Mm-hmm.
at this point. So I think, yeah, that's the main thing. And I do think that if they start to look at bleeding as opposed to the levels, more people will get diagnoses. So.
Yeah, so true. So true. I want to open it up for questions from the audience to our panelists too. But before we do that, so be thinking about your questions for our panelists, and you can put them in the chat. Hannah's going to help us facilitate some of your questions to our panelists here. But Steph, I'd love to know just your thoughts about as you look to the future. You've got kind of hit on all sides of it with hemophilia and with
Mhm.
von Willebrand's. You've seen the advancements in one sense. You've benefited from some of the things, but you've also faced so many unknowns simultaneously with your own health. How does that make you feel about future generations and where we're at? Are we making progress? How do you feel about the future?
Yeah, so we're kind of in we're in multiple spaces where we can see I feel like I can see a lot.
Yeah.
Heme Libra really has opened the door to um being able to free up time and resources so that those of us with von Willebrand disease or more mild type bleeding can be seen and be
Mm,
treated. It's also opened the door to treatment for I watched my treatment options expand when after Hemlibra came on the market.
mm,
I was able to get factor product to keep on hand after that. We've kind of watched the
mm,
slow progression of going from just DDAVP and having to deal with some pretty severe side effects with that, and knowing that if that was the only thing that was going to stop bleeding, I would deal with those side effects. And
mm,
then progressing and then being able to get a factor product that I keep on hand at home. Um, and I have a lot of hope that my daughter can get treatment and that she won't be dismissed and that she
Mm,
won't, have some of the same struggles and issues that I had, because I know we can get her the help and the assistance she needs in order to just be able to thrive and be a kid.
mm-hmm, mm-hmm. So true. It's interesting because you're talking about studies, and obviously we've mentioned Hemlibra a few times. I know
Mhm.
that there are more than one sub-Q treatments that are in trials right now for von Willebrand's disease. There is really quite a lot of activity, but unfortunately, it's so much less activity than what we've seen in hemophilia therapy. And one of the things I can say that these things do go in pretty significant waves. I mean, in the 90s, it was like there was this huge wave of treatments that came through, leaving the 80s, late 80s into 90s. We went from basically four drugs to like, 15 like overnight almost. And so I do feel like in some ways hemophilia is kind of a precursor to seeing what is developed. And we still have a lot of drugs in development with hemophilia, but most of them are iterations of similar things. But there are a
Mhm.
couple novel things happening there. But I do believe that the expansion of novel approaches for von Willebrand's, we're starting to see that kind of peek through the traditional approaches, and so I'm excited to see what happens there. I do feel like there's going to be a lot more interest in von Willebrand's disease. For me personally, I feel like that there's got to be such a public awareness strategy attached to being able to get the word out, because so many people are probably right under, just struggling, suffering, and so when you think about the things, the good things that we've experienced, and you think about all the people that may be out there, maybe even on this call, that are still searching for answers and not able to get to a specific diagnosis yet. What kind of advice would you give them in terms of how do they get to a place of being able to get the resources that even you've been able to find? And Jen, I'll start with you because you're in the middle and you don't ever get picked first on this call, I guess. So we'll go with you first now.
Thanks. Um, I, I sorry, I just blanked out for a second.
That's okay.
Um, I think that, sorry, repeat what you said.
Yeah, of
Because
course.
I had 12 things go into my brain at once,
I
and
have that
then
happen
and
all
I
the
wasn't
time.
expecting you to say me, so
I was like, well, see, I threw you off because I
you
picked you
did.
first. So when
It
you think
worked.
about the developments of products, and maybe the people who are on this call that haven't been able to get the answers that you have even gotten yet, is there any advice that you would give them as to giving them any tools that they should be thinking about on how to get to a place of getting a diagnosis or getting treated even at all?
Yes, don't give up. That's the biggest thing. I had said that I had mentioned that I had read an article, a peer-reviewed article in the journals, saying that it can sometimes take 21 times to be diagnosed. That's crazy. I
Wow.
had only done six different times they tested me at the HTC, and they just goes saying you don't have it. And that was only 6 times. I don't even know about that poor individual that went through 21 times before on the 22nd time they were magically, declared. Um, but also know your body and take
Mm,
notes, and don't take no for an answer. I had 5 people literally in this area tell me, nope, 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 nope. And I just kept looking. If you know it's happening to you, that's what you need. Give them evidence, and
Uh-huh.
don't stop. Don't stop till you get one, and make
that's
them
so
look at
good.
your stuff. If you have an injury, take pictures. I know you've been hearing it all day, but seriously, take pictures, upload it to then they have it. They can't say they didn't get it if you upload it on the portal, and let them know, because they don't, without the evidence, they can't treat you. They
Mm-hmm.
they literally cannot treat you, because this
Mm-hmm.
is a practice. Medicine is a practice, and if you're not giving them anything, they're not going to help you out. So
So
that's
true. So true. Brandon, do you have any advice that you'd give somebody who might be still trying to find solutions that hasn't gotten to the right doctor yet?
Start
with the
with an
right treatment.
organization like you guys,
Mm.
or start with a local chapter.
Mm-hmm.
They will they will help you find a doctor, and even if it's not them that fits you, they'll most of them will help you find a doctor that fits you perfect. It took 35 years for me to find the doctor that I have now. First conversation with her, she walks into the room, she sits down, she looks at me. Her first words is, "What do you want to do?"
Oh,
Mm.
I've never had a doctor ever look at me and say that.
Wow.
It the first doctor is not going to be the perfect fit, but don't give up and know you're not alone in this community.
That's so good, Brandon. Stephanie, I know you have some sage advice for us. I heard you kind of in your humming your amen corner over there. So, what advice would you give to somebody feels like they've knocked on every door and just haven't gotten the answers that they feel that they need? Is there any tips that you would give them today to encourage them to keep thinking about where to go next?
Yeah, we have a saying around this house, and it is find a different way to get a yes.
I love that.
We don't take our nose when we know that there's something more. It started with me, and then it moved on to my son because we live in hemophilia and bleeding disorders and land. There was more going
Mm,
on, and I kept getting sometimes mothers just see more than is there, but there was definitely more. And now we're going
mm-hmm,
through that with my daughter. She was obviously less critical, and we only have so much bandwidth. So she's 7 now, so we've had to wait a little bit, but now we're going to be approaching puberty, so we're bearing down hard to try to get her what she needs so that we don't go into that time unprepared.
mm-hmm,
There's always another doctor. There's always another way. Um,
mm-hmm.
and I know it sounds like if you've exhausted a lot of those options, there's more. I assure you there are more. Um, I am seeing more and more HTCs add menorrhagia clinics.
Mm,
And those clinics are phenomenal. Um,
mm,
you're gonna get heard, you're gonna get seen at those if that's one of your problems and you're a woman. There are a lot of different ways to get the yes you need to get the treatment you need. It's just finding the energy to continue fighting. And sometimes you're going to have to just sit down, take a step back, take a deep breath, regroup, and try
mhm,
again. And maybe that's a 3-month, pause.
mhm,
You're going to have to wait. But like um, did Jennifer say? Yeah, document everything. Continue the fight on
mhm,
your own and then bring all of that to the next doctor and say, I now have documentation from the last 3 months, the last 6 months. I really feel that this is important. Bring people with you who
mm.
who know what they're talking about. There are community members. I've seen them that will band together. People will come with you to a doctor's appointment if you ask
Yes.
them. Getting that second voice with you is so important.
Mhm.
Do it alone. Don't give up. There's always another way to get the yes.
That's so good. So good. Oh my gosh, what a good line. I'm gonna remember that. Find another way to get a yes. So good. I think that there is caregiver exhaustion is real. I mean, um as a as a person affected, it's even more real. I mean, it's just really unbelievable, but you've got to find the things that do give you energy. I mean, they do give you the stamina to push through and keep going. And that's not easy to find and not easy to do. Sometimes you got to dig deep, but I do think in the end it's worth it. And any progress is progress. And so, I think about doctors. You mentioned about how there is another doctor. There's always another doctor. And somebody said, and Brandon talking about how you went to 35 years of doctors before you found one that was willing to work with you in the way that you needed. And I feel like something you know, is important is you really only need one. You only really need one partner
Mhm.
that's really willing to listen to you. And some of that's a personality thing. Some of it's like you just maybe they're too stoic and they're not a, you know, they don't have a good, but they still work with you and give you what you feel like you need and hear you out. Maybe they don't, you know, maybe they're you know, whatever it is. But the point is just if at first you don't succeed, try again. And maybe there's about 35 years of tries before there's but you just gotta keep going. And to me, for me and my family and for us, it's been this community that's helped to keep us sparked and continue to give us that passion to be able to keep going at times. And our faith too. I mean, I have to say, there's just so much our personal family relationships, all of those things, everything counts. And it's amazing how, you know, we just need all of it. You can't just say that there's a one, you know, size fits all solution for everybody. It's not. It's got to be a little bit of all of it, right? I have seen some good comments going on with some questions in the chat. So I'd love to take it to maybe some questions for our panelists. And so, Hannah, if you can help me out here, and if there's any questions that you see that we can pose to our panelists, we can do that now.
Yeah, for sure. So I've seen a lot of comments and things and just kind of adds into the conversation more than questions. So since I have less questions, I'm just going to go ahead and kind of get those out there first. I have two main ones, one of which has been already addressed, but I'm going to ask it again anyway. And the other one has been a couple different people saying it in a couple different ways. So I'm just kind of bunch it into one question. Several people mentioned getting the resources and mixing those questions together, the courage to both infuse yourself and your child. And how, like, where can you find those resources, and how do you build up the wherewithal and the strength to be able to, and the courage to be able to do that when it just seems so daunting?
That's a great question.
I learned at camp. I mean,
Mhm.
where it all started, the big stick. Um, and then my daughter, 10 years old, ended up doing the big stick, and the camp in Tennessee started allowing siblings to go. And this year, my youngest daughter ended up getting the big stick, even though she doesn't even have the blood disorder.
Wow.
It started there, but if HTCs are awesome about um, having classes to help you self-infuse, or just getting together with your home care company. They can send a nurse and help you and work with you until you feel safe to do it.
It's
Yeah,
good.
it's repeated exposure to it. We started with our HTC. Things just didn't click with anyone in our family doing it with our HTC. We went to multiple sessions with them, and I don't know what it was. And then we went to an event with family camp, a family camp event, and I was able to self-infuse myself. My husband was able to get a vein on me, and both of my children got a vein on my husband, my 7 and 10-year-old. So the training just clicked for all of us. And like my 7-year-old just jumped in and she's like, I want to do this if you're all doing it. So for us, it was just repeated exposure to it. And we've gone through some valleys with it where I haven't been able to self-infuse and my husband's not been able to get a vein on me. And so we've been doing we did the ER run for like a year and a half. For some reason I had a panic attack, self-infusing after I'd been self-infusing for a couple years and don't know what happened. And then we were able to get over that. So it's not always a straight line. It's not like, oh, I was able to self-infuse and get it with the nurse. Now I can do it.
Mhm.
You're going to go through times where it's going to be hard, and it is hard.
That's true. Especially if you're learning later. I think camp is a great option if you're young and you have that kind of accessibility. But if you're learning later in life, sometimes that can be even a bigger hurdle. Jen, you have any thoughts about that? How to have courage?
Uh, to me, the alternative was not having Factor on board. So I was happy to,
Mm.
self-infuse. And I didn't have to infuse my daughters because they learned in camp. So I'm glad
Ah.
about that, because my youngest has had to get the IV team to get things, and it's sort of an ongoing thing. It seems as she's older. It wasn't that she was afraid, because she could do it at camp, but getting a vein for her has always been an issue, and we would have to go to the hospital, and we would have to make the appointment, and they'd have to get the IV team. And I don't know that I could have just continued to dig on her. I mean,
Mhm.
y'all, I'm so glad that y'all didn't have that issue, because it is the last thing I want to do is, do that to my child. So but for me, I never had any issues. I did it the very first time. And I'm so thrilled that I get to Profi.
Yeah, so true. I think sometimes just especially when you haven't had medication for so many years, like just I even know for myself, like going from on demand. I mean, I was on demand. I don't think I started Profi until I was in my mid to late 20s, maybe. It was pretty late. Not because the treatment center wasn't trying to convince me of it. They were started trying to convince me in college sometime, but it wasn't predominantly promoted in until probably the late 90s, and somewhere in 97, 98, they probably started talking to me about it. But it wasn't until I was 3 or 4 years later when I was dumb and had enough of part of it was my wife was also like, you're already infusing because it bleeds like 3 times a week. Like, why don't you just do it ahead of time, And, but once I could tell the difference between self-infusing and having ahead of time on a schedule versus chasing bleeds all the time, it was like I was a new person. And I it was and so even for me, even when I get off track a little bit or didn't want to do it or whatever, it's been a mental thing for me to just remember back to when I didn't have that. And it's really been helpful to kind of think about that. So I think that the fear of a bleed maybe is a motivator sometimes. The fear of and I would say too, one other thing that's probably not commonly discussed, but I think it's worth bringing up is that there are many people around the world that do not have access to treatment. Period. And if your doctor has prescribed it and you have access to medication, I know we're talking about all kind of hurdles and difficulties, but I mean, at the same time, like if you have it and you have access to it, I think there's a certain sense of responsibility that we have to take advantage of that privilege because it's not selfish for you to take it. It only can be used for you, and to be able to look at this and go and say, I have something that many people in the world wish they had, and it really is a gracious opportunity that I've been blessed with, and I need to take advantage of it. But I understand. I was a hard stick when I was a kid. I hated needles. Still, if I have one old faithful vein, like right here, and if that dude goes out, we're all in trouble because I don't know how to find anything else. So, I don't know, but it is something that you get into a rhythm and a routine eventually, and sometimes it's a little bit of a slow progression. Sometimes it happens more quickly for others. Hannah, for instance, she was a brave soul and took it on like a challenge, and she was like, "I'm going to live my best life and do this thing. I'll figure this out." But I think, in contrast, my younger daughter, Bella's really struggled. It's been hard. She's a very hard stick and it's difficult. and all of those kinds of things. So I think you have to figure out what works for you. I would say too, fear of not having factor might be one motivation, and then fear of going to the emergency room where you have to wait for hours and be butchered by a sawmill may not also be may be somewhat of a motivator. And one other suggestion that I like to throw out there is find a friend. I mean, make really good friends with a neighbor who's a nurse. You know, go find a nurse somewhere at your church or your local community center or something, and be besties with those folks. And you know, because they are so sweet. Sometimes you can call them up in the middle of the night, and they'll just say, "Oh, I'll come over and help you," because they want to just help people. And you know, there's that. And then I think somebody else put in the chat too is maybe call your specialty pharmacy. You may not realize it, but some specialty pharmacies will provide at-home nursing as well. So that those are some maybe thoughts to think about, or you know, resources to think about for sure. But it's no easy task, and I know it's burdensome for some people, and some more than others for sure. But great question. Hannah, I know you said you had two kind of that were compiled. Was that the two, or was there another one?
No, so I had that one was about infusing, and then I actually have two. I have the other question. I have another question now, but
Great. It's
um,
growing. This is
I know it's
perfect.
growing little by little as people are starting to process and learn. I think a big thing in this session, especially with being t- listening to people who are also in the community like them, there's
Yeah.
so much processing because it's almost like the difference between reading a dictionary and then going to therapy. Like you learn like logistical information and then you go to therapy and you have to sit and you're like, wait, my whole brain is being rewired right now.
It's
Um,
true.
but I had this shorter question that was more recent was where and when is camp? And like how can they find that for their kids? Because the person who actually commented that, I think it was Marilyn, and she has several children with both von Willebrand's and hemophilia.
Get in touch with your local HTC or hematologist, and the social worker there can help you find the closest camp. And if you don't have one close to you, they will actually, there are funds and organizations out there that will help get your child to a camp so
Okay,
that they don't miss out on it.
that's awesome.
That's great, Brandon. Yeah, I definitely suggest starting at the treatment center with the social worker. That's a great one. And then also your local chapter too. There's hemophilia chapters in every state where you can reach out to them directly by doing a search, or just send us an email as well. We can send you those individual contacts for your state. Great
And if a
question.
camp does not work out for you for one reason or another, there is another camp.
That's right. That's a good point. There's lots of folks that go to camps in different states, even, you know, that sometimes we see that, Jennifer, over in your neck of the woods, where people from Florida sometimes go over to Alabama and all kinds of places. So there's lots of options for sure. But you got to kind of keep an eye out for them. They usually happen in June or July. It's more the earlier part of the summer. Generally, you see most of them happen in, but absolutely, there are options out there.
Awesome. The next question is again, I had several people ask roundabout the same thing, so I'm just gonna kind of mush it into a question. It was initially asked by Amy Kovacs, and she said, kind of a two-part question. What do you think needs to be done to have more patients diagnosed sooner? And also, how can we advocate as a community to be able to obtain adequate treatment regimens for everyone involved?
Those are two very loaded questions.
They are very loaded questions.
So let's take what was the first one again, Hannah?
What do you think needs to be done to have more patients diagnosed sooner?
Okay, let's start there.
Hmm.
Anybody want to take that?
Bringing awareness. I think not hiding in the shadows with your bleeding disorder is important. Talking
So
about
important.
it, letting people know that you exist even. It all goes back to just, that's part of self-advocacy, like, well, not being afraid to wear your medical alert. And if someone asks why you're wearing a medical alert, explaining why, because there's nothing to be
Mm-hmm.
ashamed of.
Mm-hmm. So good.
I also think that, well, this is, I mean, I don't know how it would work, but I would like to get it into the schools, in the middle schools where, they get separated. I don't know why they separate them, because everybody needs to know how things work, but that's again a personal choice. But with the women, at least getting the information out that we now have, like, at least a measure of, okay, this much is a normal amount of bleeding with your cycle.
Mm-hmm.
Because I thought when I saw the amount of that, I was like, okay, is that for an hour? No, that's apparently over the whole time. That would raise some questions. And if people knew that that wasn't, correct, or that wasn't normal, they could look into it. There hasn't been the information, but I think it's slowly coming about. And if we could just get it out there, that's
Mm-hmm.
my
That's a good point. And that really does bring up sort of the second question, Hannah, that you mentioned, which was like, how can we as a community advocate and come together to bring awareness? I do think that some of that is that we all put our heads together and really think about how to approach these things in little ways and in big ways. It doesn't have to always be some sort of, big, huge project. I think, it's funny. I work with a lot of, people that are running national nonprofit organizations all the time in various disease states. And it's funny because everybody that's super big, like the American Heart Association and the diabetes, all of these groups, they all wish that they were grassroots. And all the folks who are actually grassroots wish that they were the super large, organizations. So I'm like, if we could just celebrate the season that we're in, but wherever you are, whether that's a situation where you're actually able to go to your local school. Somebody mentioned in the chat about talking to their local ambulance service. Those things I think help to raise awareness in ways that really do help. We are looking as an organization, we're looking at strategic ways that we can actually roll out information to places like OBGYN groups, for instance, where there's more of an opportunity to sort of provide some education on specifically for bleeding disorders to larger groups. And there's multiple different ways to approach all of that, but I just think it's really about everybody doing their part and advocating where you can. There's really not going to be a one size fits all way of educating everyone, and we sometimes want to make it easy by just trying to get everybody in the same room and do it. But to me, shameless plug, I always think that coming together at Hope Conference, especially this year in Orlando, is a great way to do that. Like if you can get together in the same room, man, those hallway conversations, you would not believe. Pretty much everything you see in the bleeding disorders community has come out of a hallway conversation. Anything good. Of course, I think there's been some bad things that have come out of that too. But there are times when you put everybody dealing with the same struggles in the same room, that organic conversation can turn into something really, really, really beautiful. And so I would just say, like, if you want to, also, just putting our heads together in moments like these is really a big piece to that equation as well. So little ways, middle ways, big ways, whatever way we can all advocate. I think every bit of rising tides lifts all ships, right?
Invite your doctors, nurses, HTC, PCPs, all to your National Bleeding Conference that we're just getting ready to have in Aurora. That's what we're doing. We have 4 doctors locally that knew nothing about it.
Wow, that's awesome. Thank you for that, Tara.
Invite them, invite them. Yes, they have to pay a fee, but if they're interested and they want to know about you, they're going to do it. And we have 4 going from rural Southeast Colorado.
Wow, that's amazing.
Fantastic. That's amazing.
So
They have to
good.
pay, but they can expense it. So just tell them that.
Exactly. That's exactly what I did. I just took all the information to the hospital because we have out here traveling doctors and everything. Well, one of them's from Indianapolis. He had no idea about it. And now he's going. I mean, I'm excited to see from my 4 people where it goes.
That's so good. That's so good, Tara.
Not to hijack the panel, but I would also add on to that, don't let those conversations stop at these events, because
Yes.
we do that so much where we're like, we're going to talk about this. And I saw somebody in the chat say that they were saying, because Jennifer, what you had said about bringing it into the sexual education classes and stuff in elementary and middle schools and high schools, you had mentioned that, and somebody said, oh my gosh, that'd be amazing, but who knows how to do that? And I know how quickly those conversations can stop when the session ends. It's like we just don't touch on it again. And I know for a fact, y'all are geniuses. Like every caregivers, I'm so serious. Y'all are like caregivers, patients, family members, friends. All of you at some point in your life have watched your friend, family member, whatever, go through something and go, you know what? I have a great idea to fix that. And then it's never addressed again. It's just gone in the wind. Like poof.
We're working really hard to create like bags to drop off from ages of like 10 to whatever age to schools here in Southeast Colorado, and probably starting all over Colorado, because we're trying to work all over Colorado, of dropping off these bags of, hey, ask your parents about this, hey, do you have these things, like, hey, this, hey, that. And we're trying to get like this, just a little postcard. And like, you know, when I was in school, you got a little baggie of, you know, personal feminine stuff, and, you know, little things of, hey, your introduction to this. So why can't one of those postcards simply be dropped into somebody's bag? What parent? I mean, somebody's going to pick up somewhere.
It's true. It's very true. Well, this has been absolutely amazing, and I know that we've really come to the end of our time here, but I do want to say thank you to all of our panelists. Big thank you to Brandon, to Stephanie, and also to Jen. Thank you so much for joining me for this panel, and I really am excited about the future. And Hannah, you were dead on right about the fact that it really doesn't stop here. It's really important that we carry this torch on, and that we keep having these conversations more and more and more. And I really do believe that together we can link arms and continue to make progress in small ways, in middle ways, in big ways. And every little win, not only when you're connected in community, every little win not only helps you, but it's going to help somebody else when you're connected. And so thank you all, everyone on this call. Thank you so much for taking the time to listen in, to be a part of this, to be a part of the conversation, to be in the chat encouraging each other, just to be able to be a part of this, because we hope to take this to the streets and help even more people. We got 3 million people we got to reach, y'all. So we got a lot of work to do, and we are nowhere near there. So I think that we're making progress, but it takes one person at a time. And I just appreciate everything you said, Tara, about that, because it's important. Just every little bit counts. It helps. So with that, I will leave it there and turn it back over to Hannah. But thank you.